So welcome to Devolution Conversation on the Health Matter. Right, this is Dialogue KE. Let's focus on the matters at hand today. See, the rationale for devolving the country's health sector was to allow the county governments to design innovative models and interventions that suit the unique health needs in that context, encourage effective citizen participation, and make autonomous and quick decisions on resource mobilization and management possible issues. However, the sector in nearly all counties is currently bedeviled with huge challenges, key among them human resource deficiency, lack of critical legal and institutional infrastructure, and a conflictual relationship with the national government. Now, on Dialogue KE, we're delving into matters health to take a look at some of the matters holding back this critical sector enshrined under Article 43 in the 2010 Constitution. On set are two gentlemen, Dr. Kahura Mundia, the Vice Chair of the Kenya Medical Pharmacists and Dentists Union, KMPDU, and George Gibore, the Secretary General of the Kenya Union of Clinical Officers. Gentlemen, welcome to Hope TV Newswatch.
Thank you.
You are the experts on health matters, so I will just help moderate this conversation. But pretty much you hold the reins, right?
Yes.
So I think our first question would be on, it's been 13 or so years since we promulgated the Constitution and then health was devolved to the counties. Looking back, do we feel we have gained much? Do we feel it was the right move to devolve health at that point, at the initial point of setting up this new Constitution? I'll start probably with you, Dr. Mundia.
Thank you. Well, that's a complicated question in a way. I don't have a very straightforward answer. It's been 13 years, yes, since we ushered in the new Constitution. And it's about 10 years since we went into the devolution units.
Yes.
In some quarters, it has worked. And in some areas, we're still struggling like we never even started. Because we have seen issues of workers being neglected for the last 13 years. And we've really tried to push. Even every day we keep on pushing. We tried during the BBI talks to have healthcare being brought in. We're now celebrating, is it yesterday? The marking of the 13 years now since the Constitution was passed. And we're probably still interested to have the discussion of having a constitutional review moment, because we feel some aspects of healthcare needed to have been centralized. Devolution is good, but some aspects of it need to be centrally managed, because as it is right now, we don't have enough capacity at the county governments.
Can we actually pinpoint some of those issues, Mr. Gibore?
Very well. I think I agree with Dr. Mundia that everything must be tested. We have tested the Constitution, and in terms of how we devolved the health services, and we get to know that there are things that have worked and many of the other things have not worked. Now, I think you understand even the growth has a stage we call exponential. Probably you might not go further from where you are, and that's where the counties are. And to be specific is that the county have done very well in terms of coming up with infrastructure. And the key reason why that is the reason is because to them that is what they call development. In terms of now what you call health is our system that has many aspects, including now the human resource aspect, the financing aspect, service delivery, we have drugs and other technology, and now what we call governance, leadership and governance. The leadership and the governance at the county level have failed. We have, in terms of management of our resources, we have now probably is an area where we say that we devolved corruption. So we lose a lot of resources. Now, if indeed then we were supposed to identify the unique problem and challenges as per the county, and we are able now to profile them so that we are able to address the challenges facing the people, the issue is that the counties, most of these counties still depend from the national government to get data, to get information on what they need to do, which is a problem.
Which is a serious problem.
So, and I normally say that now that we have 10 years since we promulgated our constitution, and two, we have 10 years since health was devolved, it is a high time that we do an audit of what has worked and what have not worked. And we agree that this is what we need to do. And we hold a position that during this time where we are having discussion happening at Bomas, the key issue to be discussed, which affect every Kenyans who sit on the table and those who don't sit on the table, who make decision and those who don't make decision. I mean, the health issue must be on the table. If health is not on the table, the only issue being discussed there, as much as they change names, is politics. Is politics, it's about leadership, it's about the people who matters. Now, you know, health is for the people who don't matter. That's probably what I can say, because for those who matter, they normally fly outside to seek their medical services. They have very good medical insurances. It's now the public sector where we serve, it offers services to majority of the people who do not have any medical insurances. So those are the people we want to be discussed on how are we going to cater and give them services that they do need, which the county have failed. And we must say failed because we still have over 24% of our people out of pocket. And people are still contributing to ensure that they are able to get services. Unfortunately, when you go to those public facilities, the lower facility, which is the dispensary health centers, are not functioning optimally. Why? They have not been given the resources to buy reagents. They have not been given money to buy drugs. There is no staff. If there is staff, it is one. And if it happens, this staff is in a dispensable position where they are either sick, they cannot be able to give services to those people. So this is how we have broken this thing. And let me mention this so that when you are going to Dr. Mundi, I can pick it from there.
Yes.
That the current government, Kenya Kwanza government, promised Kenya a number of things, including to ensure that they can restructure the management of the human resource by establishing a health service commission.
Yeah.
This service commission, it is on a ground that one, they can pay healthcare workers centrally, can manage them in terms of their training, allow them to go back to school because they will be professionals who understand the sense of adding value to training a healthcare worker. Now, the other issue which we are talking about is promotion. So all this aspect, and of course, effecting transfers inter-counties and between the national government. Those things do not crawl back counties. But when the counties came to force, they realized that there was a promise to Kenyan as it looked in that manner. Then they attacked the president. They said that you want to kill the counties. So the president took a back seat. And that's why you'll see the current budget has no budget allocation to employ more staff. And now they continue singing about the community promoters. Community promoters existed before this government. The issue which was there is that they were not in a structured, they are not captured in a structured manner where they were being paid. Now the government is saying we will co-pay them with the counties. So that is the only thing that is happening with those people. We should not by any manner think that they are replacing the professional who are supposed to ensure that key services are delivered to Kenyans.
So I think we will also talk a bit more about the human resource here that is becoming a thorny issue, left, right, and center, from the intern doctors and the employment and the 20,000 doctors that were promised. Yes. So what then should be the way forward is, this is an urgent matter. As the medics, you have presented it to the government as an urgent matter that needs to be addressed. So what should be the way forward at this point, seeing the hesitancy in the government to do this?
Well,
also, look at the movement of our nurses across board to look for greener pastures. So what is that? Is that an ironic situation that we are in, or how do we address this, where we have a shortage, yet the skill that we have around, we are exporting it out of the country?
Well, these issues of HR in healthcare, they have not started today. Actually, first agitations for reforms in healthcare started way back in the 1970s, up to 1974. That's when the roots of the doctors' union were trying to form up. Then sometimes in the late 80s, sometimes during the Moise regime, 1994, 1998, and then 2010, and then 2011, up to date. We're still talking about the same issues. Kenya has had very few healthcare workers. We don't have enough doctors. We don't have enough nurses. We don't have enough clinical officers. And currently, the population keeps on to rise. So we have enough issues for us to solve internally. But it's an absurdity that now, because the government says it's not able to absorb, we have to export persons out. We have about 6,000 doctors in the public sector, 6,000, and about 13,000 doctors in the sector.
Yes.
The country needs about 50,000 doctors. So the shortage that you keep on hearing about is an artificial shortage. We don't have enough persons to provide care to Kenyans. That's why you have issues of queues, long queues, lack of special doctors in the counties. You have keep on transferring patients from one county to another county. Such issues are not really what we aspire as per the constitutional provisions of Article 43(1)(a). Everyone is entitled to the right to highest quality standard of healthcare.
Yes.
We cannot afford to give that when you don't have persons available to provide that. You have a facility, like let's say a county has sub-county facility hospitals, having like one doctor, 2 clinical officers. But the persons coming to that area, there are quite many, and they're not able to, patients are not able to access the care that they need. So such kind of discrepancies create more absurdity when you start exporting everyone to go abroad. But
So
since we're not able to, let's create the
but
opportunities.
it's a conversation that is already on the government's table, in the Ministry of Health table, right? So what is the response so far on this matter of human resource?
Well,
As union leaders,
the other day you saw the KHRAC,
Yes.
Kenya Human Resource Advisory Council, being launched. It's launched 5 years late into time. It was supposed to come up into effect in 2017. It never did. And now it's like 4 months old, and it operates like a body that represents the government's interests. It has not incorporated the unions. We are not represented there. So our issues, what is bedeviling the healthcare space, is not addressed. So we are yet to hear. They are even yet to call us, but we keep watching.
Yeah, those are very key questions. And you see, when you talk about the healthcare workers in the health sector, they are the engine of delivery of services.
Yes.
So once that engine is not able to take up, then the services are as dead. Why am I saying that? Is that when he talked about the KHRAC, the KHRAC, we are the people who architectured and pushed it there then, because our main issue was to establish the Health Service Commission, but every politician was against it. If you look at the mandate that has been apportioned to it on that act, it does not amount to anything. So whenever I saw the other day when they were trying to launch it, then I said, I think we have missed it. But however, if you have to look at what it's supposed to be doing to foresee the situation of training and establishing policies, we do not lack policies in this country. The HR policies in this country are such astronomers. They are good. What I mean is that this country has what we call staffing norm. The staffing norm is an international tool established by the WHO. It informs the ratio of staff you're supposed to have at a certain level vis-a-vis the population density. So that is to mean that you are supposed to have close to 45 healthcare workers per 10,000 population density. That is kwa jumla. So we are doing actually less than 11 healthcare workers per 10,000 population density. So just look at the gap. Now, when we see a situation where we are taking our people outside the country, but I say it should not be the case, because either we are training for other countries, then because the world has become more of a global village,
Yes.
then that is good. But in case where we don't have enough and we have not allocated even a single cent to employ, then it worries me that we don't care about our Kenyans. Those countries that are importing our healthcare workers take care of their people. Their people are their responsibility. Then who should take care of Kenyans if at all we are just celebrating taking them out? But I say, we are like now in the country we have close to 26,000 healthcare clinical officers who are ready to work. The government has employed around 7,800. And if you look at it, 800 are on contract, the UHC staff, and the much they can be afforded to be paid is just 50,000. For those who are even employed on the permanent and pensionable, they are paid a basic salary of 23,000. we have a country that never think about healthcare workers, but always what I remind the healthcare, the politician, is that these healthcare workers that you always forget about, they make a decision about your life when you are not even able to make a decision whether to eat or not. So these are the key people you need to think about when you wake up and when you go to bed.
Dr. Mundi, I am curious. Are there things that we can say are gains since health was devolved? Now that we have looked at the other side of things that we probably don't like so much. But do we have any gains? Do you have any good things that have happened since health was devolved?
Well, the
to
good
county
things I
governments?
could say, like what Mr. Dibore had said, infrastructure setup.
Okay.
Well, we have tried. I would say I could score maybe at 50% trial. Because before 2010, most of the county governments, let's say they're not county governments, most of the provinces, they did not have enough medical equipment, like CT scans, MRIs, or maybe enough facilities, like the referral centers like we have right now. And comparing that 10 years, before that 10 years, 2010 and now, you've seen all that change. So the cost of MRI at that particular time was about 50,000. Right now it's gone back to about 15,000. It's quite cheaper, even like South Africa, it's more expensive than it is in Kenya. So with such advancements and bringing of such equipment, we are able to appreciate the value of consuming such services. But now the issue comes in the HR. The machines are there,
But the
the
people
equipment are
to...
there. Yes.
Okay.
It becomes our challenge now to still continue to give more efficient services because we don't have enough personnel. And training is an issue because county governments feel like if we train more, it will cost us more. So
Yeah.
they reserve themselves and not train doctors. So it's an absurdity.
That's
You
an
want
absurdity,
to give
yeah.
services, but you still don't want to facilitate the whole process.
Yes.
So,
Gibore, do you
Yeah.
think there's a gain?
Yeah, I
with
think
devolved
that's why
health?
I started, and I said that when the tool of work is
Yeah.
a hammer, everything you see, every problem you see is a hammer. So the issue we have is about the politician. When every development they look at is in terms of bricks and mortar, and that is why we are celebrating. And actually, what he's saying, I need to be factual and say that close to 78% of our establishment, we have enough facility. We have Turukana, Mandera, and the northeastern counties that have not reached the facility density to population. So those are the few counties that have not, but a majority here have. And I can give a good example. During the NMS here in Nairobi, we built 22 facility here in Nairobi,
Yes.
but the healthcare workers are not there. A majority of these facilities are operating minimally. What is the sense of having a facility that is not functional? We are not interested of looking at beautiful buildings where they are not functional. What we are looking at and where the world is going is about patient-centered. The patient is able to get the services where they need it, and they are well incorporated in terms of managing their welfare and making decisions on how they need to be attended to. So this is missing in our arena, and still patients are struggling. We are still, majority of Kenyans are still not able to access services. If today you are doing the survey, you'll realize that there are patients who have not gone to the hospital today because they know that if they go, they will not meet a doctor or see any clinician there or even a nurse. Even if they go there, some of them will find these medics there, but they might not get, the laboratory is not functioning. So that's another area. Then again, if you move to another county, the facility, you might find a healthcare worker, like now, let me say Nakuru, because that's where they have spoken during the conference. They said
Yeah.
it is rating high.
Yes.
Then there is a healthcare worker, probably, who is not paid well and does not have the interest of even serving. Will see you, will send you to the laboratory, but there is no medication. So we have failed in many angles that we feel that we need to have a central body that within a button you are able to get answers ranging from point A to point B. I've seen the president have launched another team which they call facility services. They have gone to check the facility services level. That's to mean they have to ensure that really when we are going to launch the UHC, because we are launching it, I don't know, for the fourth time, when we are going to launch, we are sure that if there is a health center, we are told they are over around 5,000,
Yeah.
then that health center, the services corresponds to that level. That's what they are going to do. But again, they are going also to establish the gaps that exist between the staff and the staffing norm, the policy. What does the policy says versus what is the real on the ground? But will it make a change where the whole year we have not even projected to employ even a single one?
Gentlemen,
So
this conversation
have
can
a
get
fear.
all.
We have a fear, but we need to encourage that the few positives that
Yeah,
are there
yes.
need to be relooked into and they be capitalized on. So that we do not always keep on lamenting and doing nothing. When we talk about CBS, we want CBS negotiated and the focus be, because when you send people to the farm and you have not given them a panga or even jembe, and you tell them to go and work on them, what will they do? This is the kind of healthcare workers we have in this country. Demoralized, and that is the mental issues is affecting the healthcare workers because they are totally on their own. Yeah.
Dr. Mundia, you wanted to add
could
something?
add,
Yes.
We have policies.
Yes.
But some of these policies, they've been made into laws that are too weak. And there's no implementation. Our regulatory bodies have failed us. And because there's a lot of politics, the county governments have now want to watch on what they're doing. And the regulatory bodies, because they know there's a lot of politics in the game, they don't want to come in and tell the facilities and tell the county governors, this is not right, this is not right. But there is no law to actually tell them, you should have this number of doctors, this number of clinical officers, this number of nursing officers. Without such, that means everyone is operating in freestyle. And it's been a freestyle way. So it's work and work and work, but without guidelines as such.
We need to wrap this conversation
If
up.
you
I
are-
think your final words,
if
sir.
you
Yes.
allow. I pick it from where the policies that we have made. If you see of the recent past, there was a cry in Nakuru.
Yes.
Healthcare workers being
Yes,
fired.
yes.
And considerably. These are healthcare workers. They have been engaged for 3 years on contract. And I want to say what we talk about policy and act. The act provided that the workers that we should be put on contract are workers that exist in a range where there is no one on PNP. Now, where there is PNP, those workers should be treated equally. Now, that is a section of an act which have been outlawed or rather are not ever considered by any employer in this country. So here in Nairobi again, we have the NMS, and across the country we have the UHC staff. Put on a different, and you see, our government is funny. They know that we have an act of parliament, establish a title of clinical officer, the medical officers, the nurses, but they go there and outlaw them. They come up with a funny name like UHC staff so that they can pay you below your pedigree. They also come up with the other things called NMS staff. The NMS staff also exist in their own, and there is no way these people who are already established in an act of parliament, they have titles. You take away the title, you call them hospital employees for purpose of fitting whichever you want to do, manipulating them and paying them below what they are supposed to be getting. This is the kind of hypocrisy we are calling out the politician to stop and the focus to give dignity to healthcare workers. Thank you.
Thank you so much. You want to finish? Yes.
Well, I will agree with Mr. Gibore that differentiation of workers is not proper. It's an illegality. It's strictly stated in the Constitution, no one should be discriminated against.
Yes.
So these workers, they have similar qualifications. They have similar papers. They do similar jobs, similar hours. But you find that you are two of you in the same hospital doing the same jobs, but one of you earns more than the other. Reason being, the county wants to say, I don't have enough money, so I'll bring in a few more at a lower rate, while the others are being paid more at a higher rate. So it's
an
kind of
absurdity,
a confusion that doesn't need to exist, but it's something that we're still pursuing. And these persons, the ones who are actually being underpaid this much, being discriminated against, they should be equalized the position of these other workers. And that is a call to all governors, all employers to consider to harmonize all workers' pay.
Harmonize all workers'
And
pay.
give equal terms and pay.
Thank you so much, gentlemen. Dr. Mundia from the KMPDU and Judge Gibore, thank you so much for your invaluable time to come and just shed some light on the state of health in this country. Until next time, I've been your host, Melissa Dor. Have a wonderful evening.
Thank you.
Thank you.
Thank you, gentlemen. I think we're off.